morning. Every year, we get a look inside our nation's mental health and substance abuse use challenges with a national survey on drug use and health results. We're taking a look this morning at this year's results, which are from the year 2021. And to help us break them down is Dr. Lokesh Shahani. Dr. Shahani is an associate professor of psychiatry with UTHealth Houston. So he's seeing firsthand a lot of these statistics in reality as they come in. Let's take a look. We're going to get right to these numbers, right, Doctor, and break them down. We thank you so much for coming.
Perfect. Thank you so much for having me.
Yes. So more than 46 million people ages 12 or older met the criteria for having a substance abuse.
And that's really concerning. If you break it down further, it says that patients, adults between the ages of 18 to 25 are actually at the highest risk of developing a substance use disorder and making up the largest proportion. It's really concerning because, that's our youth, that's the future of our society, that's the population that contributes most to the society, and becomes really concerning.
That's very troubling. And this just isn't something that impacts our youth. It's obviously impacting their parents and the rest of us in the community.
Very true, very true. If you ask me why are the youth more predisposed or why do they make up the largest proportion of the population, it's a lot about, experimentation. When we are young adults, a lot of us, experiment things, and when you have a higher risk of experimenting, you have a higher risk of developing a dependence or addiction to that substance.
And some of that can come back to peer pressure too.
Exactly. What's really changed in the past couple years is a lot of influence of social media. There's a lot of online bullying, a lot of dating violence that's gone up, which is all adding up to the increase in substance use.
And when we talk about substance use abuse and when we talk about bullying and mental health, you're seeing that nearly 25% of people 18 or older have had a history of mental health illness, and that can start as a child.
So we as mental health experts have been struggling with this concept of substance use and mental health. It's almost like a chicken and egg kind of a question.
Yeah, what comes first?
Does substance use predispose you to mental health, or does mental health predispose you to an increased substance use? But at this moment in 2023, most experts think it's more of a bidirectional thing. It's more kind of, one adds to the other and adds fuel to the fire.
That's fascinating. It truly is. I know this report also shares more than 13% of young adults ages 18 to 25 had both a substance use disorder and a mental illness.
So this report came out in 2021, and 2020 did really change the world. The COVID-19 pandemic was at its peak in 2020 and 2021. There has been significant rise in mental health and substance use post the COVID pandemic. There are a few theories kind of out there. There's been an increase in abuse, both emotional as well as physical, happening during the pandemic. There's a lot of food insecurity, housing insecurity because of the financial market, the job market outside, and all of this is contributing to increased stress in our society.
It's like an onion. There are so many layers to this.
You said it right. You absolutely said it right.
What if people suspect, or if they're looking to help someone, what are signals that someone should be on the lookout for when it comes to having, substance abuse usage or mental illness?
So for people who are able to recognize it, feeling excessively sad, having crying cells, being emotionally sensitive are obvious signals. But for family members, change in functioning levels. So if your children, your youth is missing classes, grades are going down, they're not able to make it to work, those are obvious signals that there's something going on.
Yeah.
So changes in their functioning.
Now, what if it's you? What if it's you that realizes, I need help. Something's wrong. I need help.
So, obvious signs of depression are, too much sadness, a lot of worries, changes in sleeping pattern, changes in eating pattern. If I am not motivated to get out of bed every morning, that's a big, big risk factor that I face.
Dr. Shahani, we appreciate you coming in this morning.
Oh, thank you so much for having me, Zach.
Yes, absolutely.